Tonight, more than 2,200 Kentuckians are in the hospital with COVID-19. For the state of Indiana, it's more than 2,400. While that number is down from a week ago, it is still 6 times as many patients from July. We brought you the story a few weeks ago of one man in Bardstown who said people's decision to not get vaccinated may cost him his life because there's no room for him at the hospital. We stayed on the story as so many of you were outraged. Tonight, the good news, he now has hope that he's going to get that surgery. Focus investigative reporter Paul Vassan is back, explaining why he says hospitals need more resources to help others just like him.
When we met Gary Borland and his wife Jo 3 weeks ago, the words were too painful to speak. His reality, too overwhelming.
It could cost me my life.
Because of a disease spreading through his body.
Stage 4 colon cancer.
And a hospital system that didn't have room for him.
They are at capacity.
Their beds filled largely by people who aren't vaccinated against COVID-19.
To me, it's just not right.
A former Vietnam veteran, Gary told us he's paid his dues to his country, but his country has turned its back on him.
Again, that's the way I feel.
It's been a few weeks since we interviewed Gary at his home in Bardstown. After his original surgery at another Louisville hospital was postponed indefinitely, he was left waiting, desperate to remove the tumor from his body, desperate for a surgery date, until now. Soon, he'll be here at Norton Hospital.
I know that I got to keep going somehow.
We met up again with Gary and his wife of 36 years, this time about 9 miles away from Norton Hospital, outside the cancer and blood specialists of Louisville.
So you've gotten your blood test done.
Where doctors are making sure he's ready for the day he's been waiting for.
Set up as September the 27th on a Monday.
Life-saving surgery to remove his tumor, finally on the calendar.
Yes, I'm very happy.
We're ecstatic that he's got a surgery date. It was a great relief.
A relief that shouldn't have come to this, says Kentucky Senator Steve Meredith.
To me, if we don't address this very soon, we're reaching a point of no return.
As unvaccinated COVID patients drain hospital resources, people like Gary are put on hold.
So every day that you're waiting is another day that's going to make it difficult to have any recovery, if recovery at all.
Do you see this strain on the hospital system getting better anytime soon?
No, I don't.
Senator Meredith says more people need to get vaccinated against COVID so hospitals can better help people like Gary waiting for care.
It's needed, desperately needed.
Desperately needed, he says, because about 1 in 4 hospital beds in Kentucky are taken up by COVID patients. In the intensive care unit, that ratio is 1 in 2.
And the lack of personnel is straining the system, and I think we're going to see more and more of this. I'm quite concerned about it.
Among those in Kentucky hospitals with COVID, more than 91% have been unvaccinated, according to health data. It's data that makes Gary hold his breath.
I think, is it going to happen this time or is it not?
Not knowing if his surgery may be delayed once again.
I just hate to think about it being disappointed again.
And it makes this couple implore people to get vaccinated against an unforgiving virus.
I think a lot of people are kind of numb about it and they really don't think that it's actually going to happen to them.
But when it does, Gary says others suffer. And after a month of waiting for surgery, he says he has been one of those paying the price. For Focus, I'm Paula Vassan.
We'll be sure to keep you updated on Gary's progress as he heads into that surgery. This is one of our most talked about Focus investigations, and we originally learned about this story from a viewer. So if you have something you'd like the Focus team to look into, send them an email, focus@WHS11.com.